This week's module reviews the topics of teaching, learning, healthcare quality and safety, and informatics. Related to the teaching-learning process, we want to think about the teaching as more than just transmitting information. In order for teaching to occur, the information must be received, understood, and evaluated by the learner. Adult learning theory tells us that adults are voluntary learners who learn best when they want and need to learn. They want to know why the information is important and how they can use it. They need to be treated with respect and consider their past and prior knowledge and experiences, and they learn when they participate in the learning process. Domains of learning include affective, which are the attitudes, feelings, and values; cognitive, the knowledge and thought processes within the individual's intellectual ability; and the psychomotor skills, which is the processing and demonstration of behaviors. So if we want to have a long-lasting change in observed behavior, which is those psychomotor skills, the value of that change, the affective domain, and the capacity to understand and process the information, the cognitive domain, must first be present. So in the teaching process, you can utilize the nursing process. So the first is the assessment, to gather data about the learning needs, motivation, and ability to learn. Then come up with a diagnosis and identify the patient's learning needs on the basis of those three domains of learning: affective, cognitive, and psychomotor. Plan by establishing learning objectives stated in behavioral terms. Implement teaching methods involving the patient and caregiver when appropriate, and then evaluate to determine if the outcomes of the teaching-learning process were achieved. If your learning objectives are stated in behavioral measurable terms, you'll be able to determine if that teaching was effective and then reinforce as needed. And the same process can be followed for peer and team education. The teach-back method is one method that you might be familiar with, and it speaks to confirming that your message is understood. So the clinician teaches the patient that new concept, asks the patient to recall the information and demonstrate, clarifies when needed and tailors that explanation, reassesses and asks the patient to demonstrate, and then the patient with their recall is able to demonstrate mastery. The SHARE approach is a training program developed by the Agency for Healthcare Research and Quality, or AHRQ, and it helps healthcare professionals work with patients to make the best possible decisions related to healthcare. And I provided a link in this week's module to their training materials, as well as a video on using the teach-back method in a cardiology practice in teaching daily weight management. As you're educating your patient, you also want to consider what are their sources of healthcare information. We all know there is a lot of information out there on the web, but are these resources something that the families are using that are credible? I've provided these links for the Health on the Net Foundation and Medline Plus in this week's module as credible sources of medical information. On the topic of quality and safety in healthcare, the Institute of Medicine, back starting in 2000, set out to publish a multi-phase quality initiative, and it focused on quality programs and multiple levels of system reform that were needed. So to Error's Human Report really challenged the healthcare system to think about how organizations contribute to error, and it moved away from individual blame. Crossing the Quality Chasm talked about where the new healthcare had to go in the 21st century, the keeping patients safe, transforming the work environment of nurses, expanded upon that, and then the most recent, The Future of Nursing, Leading Change and Advancing Healthcare document, talked about specific recommendations, such as instituting nurse residency training, increasing the percentage of nurses with a BSN to 80%, doubling the number of nurses with doctorates, and recommendations to allow nurses to practice to the fullest scope of their license and education. National patient safety goals were developed to address specific areas of concern in regard to patient safety. In your clinical practice paper, you will be asked to go to the National Patient Safety Goal website to choose one of these goals that you will further expand upon in your paper. So these goals have been developed by a panel called the Patient Safety Advisory Group, which consists of nurses, physicians, pharmacists, risk managers, clinical engineers, and other healthcare professionals who have hands-on experience in addressing patient safety issues. Some example patient safety goals are improving the accuracy of patient identification, and under each of these there are specific examples and targets. Improve the effectiveness of communication, improving safety of using medications, reducing the risk of healthcare-associated infections, and implementing evidence-based practices for preventing surgical site infections. In the report, I mentioned to Err is Human really challenged the healthcare system to think about a culture of blame and move to a culture or a just culture that recognizes errors as a system failure rather than individual failures. It doesn't mean individuals are not accountable for the actions, but they are encouraged to work towards change. So inaction is taboo, and there's no room for those who say, I reported it, I didn't do it, it's on to the next person. So this model, this Plan, Do, Study, Act model, is a model for improvement. It is where you're looking for more accelerated improvement. So look at what are we trying to accomplish, how will we know the changes in improvement, and what change can we make to result in improvement. And this model by the Institute for Healthcare Improvement can be one when you're looking to make a change to result in improvement. The National Database of Nursing Quality Indicators, or NDNQI, measures nursing quality outcomes with the goal of improving nursing engagement, strengthening the nurse work environment. It assesses staff levels, and can improve reimbursement under our pay for performance system. So there are nursing sensitive structure, process, and outcome measures, and it looks at the relationship between quality indicators and outcomes. So examples are pressure ulcer rates, nursing hours per patient day, patient falls, nosocomial infection rates. Last week we mentioned the Quality and Safety Education for Nursing, QSEN website, and I took you to some of those tools that they have there. And they also have particular competencies. These competencies have been adapted by the American Association of Colleges of Nursing, and the competencies reflect patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. And there are specific details under each of those competencies. And QSEN is another topic that will be talked about further in your Nursing 465 Safety Strategies course, and we have threaded it throughout the curriculum. So on the topic of nursing informatics, the idea is that the common elements with informatics is that you're looking to transform data to provide wisdom that supports and advances nursing practice. So some examples and some of these tools you may use in your own practice are staffing and scheduling systems, electronic health records, safety monitoring tools, EBP information. So as you're on your unit, you may have access to EBP resources that you can implement right away in care. And then telehealth is another area where informatics is used in detail. And this we know is always expanding because of the advances that are coming about in electronics and data. Here are the resources for this week's presentation, and some other resources are also posted on this week's module, so I would encourage you to look at them as well. Thank you for your attention.